Yo guys, retrograde ejaculation is the topic today. Retrograde ejaculation is our word for today. The channel is Nazvin. Please subscribe, share widely, and also give a nice comment down below, because this is where we get to share matters medical in a simple language which a larger population can always understand. I always try to make it very simple and very easy for you to understand some of these technical aspects of medical. So retrograde ejaculation is our word for today. Ejaculation is the word for today, and this is when semen enters the bladder instead of being expelled through the urethra and during ejaculation. That is our topic for today, guys. This normally occurs when the bladder neck muscles fail to close and properly allowing the semen to flow backward in the into the bladder. And here are some of the key pointers about retrograde ejaculation. Number one, when we talk about the causes of retrograde ejaculation, number one, we're talking about retrograde ejaculation can be caused by various factors, and that's what we're going to look at. Number one on the causes is about surgery of the bladder, neck, or the prostate can cause retrograde ejaculation. Nerve damage due to conditions such as diabetes, multiple sclerosis, and also spinal cord injury can also be one of the causes. Medications that affect the bladder or the prostate function, such as alpha blockers, what we call alpha blockers, or certain antidepressants. Antidepressants are the drugs which are psychotic, which work on psychotic disorders. So when they are introduced, they can also affect, they can cause retrograde ejaculation. Previous urethral or prostate surgery also, guys, it can cause such kind of retrograde ejaculation. Certain medications, such as certain medical conditions, such as congenital abnormalities of the urinary tract, can also come up. And when we talk about congenital, we mean these are the things which someone is born with, or abnormalities which one is born with. So sometimes people are born with abnormalities of the urinary tract, and this can cause the flowing back of those sperms to the bladder. When we talk about the signs and symptoms of retrograde ejaculation, we are talking about the primary symptom of retrograde, or how you come to determine how to know somebody has retrograde ejaculation, is a dry orgasm, or where one does not eject out the sperms when it is on the climax, where where we get that there is no sperms, or there is little semen ejaculated from the penis. So men with retrograde ejaculations may notice cloudy urine after ejaculation due to the presence of semen in the bladder. So dry orgasm is one of the symptoms, and that is the number one thing which can happen: dry or some semen coming out or not coming out. And when one gets to void or urinate, you get that the urine is very cloudy after that. How does one come to make a diagnosis or come about the retrograde ejaculation? Is typically diagnosed based on symptoms and confirmed through the urine analysis after ejaculation. So after ejaculation, if there is that indication, the urine is taken, and also to identify the underlying cause, also from the physical examination, medical history, or other additional tests. At some point, through treatment of the retrograde ejaculation depends on the underlying cause and the individual's goals. So options include medication is one of the goals on the part of treatments, where alpha, like I've talked about, alpha adrenergic agonists are introduced, where they can help close the bladder, neck muscles during the ejaculation. So alpha adrenergic agonists drugs are introduced to make the neck of the bladder close, so that during ejaculation we don't have that retrograde. Fertility treatments. Men interested in fathering children may undergo fertility treatments such as sperm retrieval, or what we call intrauterine insemination, or IUI, that is intrauterine insemination, to collect the sperm from the urine, or retrieve it directly from the testicles to use in assisted reproductive techniques. So for fertility challenges, the sperms are harvested either through the urine or through directly from the testis. Is a way the technology which is used, where one gets to the sperms to be harvested for fertility issues. On surgery as a last option. So in some cases, surgical procedures may be performed to correct the anatomical abnormalities or restore the normal bladder neck function at that particular point. Number 5 is about the impact on fertility. Retrograde ejaculation can impair fertility, guys, because semen is not ejaculated from the penis during the intercourse, and it makes it very difficult for sperm to reach the egg. However, with appropriate fertility treatments, men with retrograde ejaculation may be able to get the children with the methods I've really mentioned. So when we talk about also on the long-term outlook on the retrograde ejaculation, the long term depends on the underlying cause and the individual's response to treatment. So in many cases, retrograde ejaculation can be managed effectively, guys, with medication or fertility treatment. This allows men to maintain sexual function and, if desired, achieve fatherhood, because most of the retrograde ejaculations can be one of the cause of infertility in men. Guys, it is very essential for men experiencing symptoms of retrograde ejaculation to consult with the healthcare provider as appropriate, professional for evaluation and appropriate management, so that prompt diagnosis and treatment can help alleviate the underlying causes and also improve the overall sexual health and the fertility outcomes as appropriate. On the part of the treatment, guys, for the treatment of retrograde ejaculation, it depends on the cause. I've mentioned about medications can be introduced. When we talk about medication, we are talking about alpha-adrenergic agonists. These medications, such as what we call pseudoephedrine or imipramine, which can help tighten the bladder neck to prevent semen from entering the bladder. Also, the bladder during the ejaculation. They also typically taken before sexual activity. So the alpha-adrenergic agonist, what we call like the drug like pseudoephedrine or the imipramine, are introduced so that they close that neck of the bladder, so that the sperms don't come during the orgasm to the bladder. Instead, they are pushed out where they are supposed to be deposited. And guys, you know where they are supposed to be deposited. Hormonal therapy is also part of the treatment, where in cases where retrograde ejaculation is caused by abnormal hormonal imbalance, hormone replacement therapy can be prescribed to restore the normal hormones as appropriate. Also, on the part of adjusting medications is also part of the management or the treatment, where if retrograde ejaculation is caused by medications such as alpha blockers and antidepressants, as I mentioned, adjusting the dosage or switching to alternative medications may be recommended as appropriate. Also, we have options of treatment for fertility treatments. For men interested in fathering their children, fertility treatments may be necessary to correct the sperm for use in assisted reproductive technique. Options include sperm retrieval as one of the options. Sperm can be retrieved from the urine after ejaculation, or directly from the testicles through the procedure such as testicular sperm extraction, what we call TESE or TESE, or percutaneous epididymal sperm aspiration, what we call PESA. PESA. Pesa in Swahili means money, guys. So we have this percutaneous epididymal sperm aspiration, what we call PESA or PESA. So that is also another method in which the sperms can be collected so that fertility issues can be approached. Also, we have intrauterine insemination, when what we call IUI. So where sperm is collected through the retrieval procedures and can be washed and concentrated before being inserted directly to the woman's uterus during the ovulation stage. Also, we have in vitro fertilization or IVF, where sperm and eggs are collected and combined in a laboratory setting and resulting to embryos that are transferred to the woman's uterus for implantation, which is very important. Also is a mode of giving birth, which is now a technology. Surgery as an option also. Surgical procedures may be performed to correct the anatomical abnormalities or restore the normal bladder neck function. So surgical conditions may include bladder neck reconstructions or transurethral resection of the bladder neck to help the lady or the man get to the fertility levels. Number 5 is about counseling as a form of management. Counseling and support is very important, where men experiencing retrograde ejaculation may benefit from the counseling or support to address the emotional or the psychological concerns related to issues of the sexual function, because normally men are really affected when this issue comes up. So guys, it's essential with the patients, with the individuals with retrograde ejaculation, to consult with your healthcare provider, preferably a urologist or a fertility specialist, to determine most appropriate treatment approach based on the underlying cause. So overall health and the personal preferences are also taken care of at that particular point, so that prompt diagnosis and treatment can help symptoms effectively if desired, and also achieve the fertility goals. Because this retrograde thing really affects retrograde ejaculation really affects fertility, and that's the main concern for men and also the couples. That one is approached at that particular point with the healthcare provider. Sometimes, especially in Africa, this thing can be taken as witchcraft, is black magic. But with the help of the healthcare provider, because we have mechanisms, guys, in our hospitals, which now can help you get to that level where now you can get well and also get to the fertility extent. So we have those mechanisms available. How can we prevent retrograde ejaculation? Preventing retrograde ejaculation involves addressing underlying cause and minimizing the risk factors involved that contribute to the condition. So while some causes of retrograde ejaculation, such as congenital abnormalities and certain medical conditions may not be preventable, there are steps individuals can take to reduce the risk of developing or exacerbate the condition. So apart from the congenital abnormalities or being born with that kind of a problem, or the kind of medications which one is on, so there are some things which can really help so that you don't worsen the situation, and also not to put you at risk of developing the retrograde ejaculation. Number 1 is about managing underlying medical conditions, which is very important. With the proper management of conditions such as diabetes, multiple sclerosis, spinal cord injury, or prostate disorders, can help reduce the risk of nerve damage or dysfunction that contribute to the retrograde ejaculation. Number 2 is about avoiding medication that affect the bladder. If possible, avoid medication known to affect the bladder or prostate function, such as the alpha blockers used to treat the high blood pressures, because someone may be treating high blood pressure, but at the same time causing a problem with that retrograde ejaculation. So certain antidepressants and psychotic drugs can also cause that problem. If these medications are necessary, discuss potential side effects. That's why, guys, even from our previous video I mentioned, always discuss the side effects of the drugs you are on with your healthcare provider, so that they can give you proper side effects and also your expectations of the same. So explore alternative options and determine the appropriate options of treatment as appropriately. So also very important, practice safe sex, protecting against sexually transmitted infections, which can bring about the complications that may contribute to the retrograde ejaculation, because some of the STIs or sexually transmitted infections, such as gonorrhea, such as syphilis, such as chlamydia, can cause problems with your urinary tract system, and also cause that retrograde ejaculation, and also cause infertility issues. So always use barrier methods during sexual activity to reduce the risk of sexual transmitted infections if you are with multiple partners. Number 4 is about maintaining healthy lifestyle. Guys, you have seen in our previous videos, we have talked about maintaining healthy lifestyle. When we talk about this, we are talking about the exercise, we are talking about the diet, and also regulating our weight to the required standard, so that we don't predispose ourselves to other medical conditions or chronic illnesses, which can predispose us through the medication or the condition, which can really bring us as problems. So adopting lifestyles, habits, good lifestyle habits, which can help us support the overall urological health and reduce the risk of conditions that may lead to retrograde conditions. These include maintaining a balanced diet and also engaging in a regular physical. Yes, guys, maintaining health lifestyle is also a very important aspect, where adopting health lifestyle habits can help reduce the support of our urological health and reduce the risk of conditions that may lead to retrograde ejaculation. These include maintaining a balanced diet, engaging in regular physical activity, and also avoiding excessive alcohol and tobacco use, and also managing stress effectively, and also getting adequate sleep, guys. I think from our previous video I mentioned about sleep and the importance of it, and the effect of alcohol and the tobacco use, how it really affects our lives. So also number 5 habits, and that is where men we score very poorly, is about seeking prompt medical attention. If you have a problem, kindly seek help immediately from your healthcare provider, because that is very important for you. So when you see things like dry orgasms, I talked about dry orgasm, where you don't ejaculate. You expect when you are on orgasm and the sperm should come out when during orgasm, but instead of coming out, you have a dry orgasm. At the same time, when you go to the toilet and you urinate or void, you have cloudy urine after ejaculation. Those are some of the things which can make you seek medical attention. Seek prompt evaluation and treatment from healthcare profession. Early detection and management of underlying conditions can help prevent and improve the outcomes at the end of the day. Because the longer you leave it, the more you predispose yourself to a lot of problems. Number 6, communicate with your healthcare provider. Very important. Discuss any concerns or symptoms related to sexual function or urinary health with your healthcare provider as appropriate. So guys, unfortunately, I don't like talking about this, but these things happen. When we talk about complications, we have now another level where if these things are not managed at a certain level, we develop complications, or the patient develops complications. And what are some of the complications of retrograde ejaculation? Number 1 is about, maybe let me mention that complications of retrograde ejaculation can vary depending on the underlying cause and individual factors. So some potential complications also, they include infertility. That's a major common problem or a major challenge which comes up with the retrograde ejaculation. And when we talk about infertility, I've explained the process where now we have ejaculation not really helping, where semen is not ejaculated from the penis during intercourse. So this can make it difficult for the sperm to reach the egg and fertilize it on the female side of it. However, with appropriate fertility treatments, men with retrograde ejaculations can still be able to father children, especially when we involve the IVF, when we have direct harvesting from the testes or from the urine, so that we fertilize that egg. We have number 2 concern about reduced sexual satisfaction, where dry orgasm with no oral semen is being ejaculated from the penis can affect the sexual satisfaction and intimacy to both partners, because no expectations are not met. This can lead to emotional distress and also bring some strain in that particular relationship. Number 3 complication is about psychological impact, where now dealing with the challenge of retrograde ejaculation, such as fertility issues or a reduced sexual satisfaction, can take toll on mental health and also emotional well-being. This may lead to feelings of frustration and anxiety. We have depression at the end of the day, and also low self-esteem. Number 4 complication is about underlying health conditions, where now retrograde ejaculation may be a symptom of underlying health conditions such as diabetes, multiple sclerosis, spinal cord injury, or prostate disorders. If these conditions are left untreated, these conditions may lead to the other complications, such as which affect the urinary and also the sexual functions, as talked here. Number 5 is about the complication of the side effects of treatment, where some treatment options for retrograde ejaculation, such as medications or surgical procedures, may have potential side effects or risks for the patient. It is very important to discuss with the healthcare provider and weigh the best option because of that. Like when we talk about prostatectomy, can bring about this condition, so the patient should be taught well and also weigh the option, discuss with your healthcare provider about the options available and also the side effect of the same, of the drugs maybe you are put on. Like we talked about the adrenergic drugs, we talked about antipsychotic drugs. So very important that you discuss the same side effects with your healthcare provider, so that you are aware of the benefits. And most of the time we want to get more benefits than the risk for you at the end of the day. Also, as a complication, we have the impact of quality of life. With retrograde ejaculation and its associated complications, this can significantly impact the overall quality of life, affecting physical health and also emotional well-being and interpersonal relationships, as mentioned. Number 7 is about the potential financial implications. That's very important because economically you can be really strained, because seeking treatment for retrograde ejaculation and related fertility issues involve significant financial cost. Things like doing IVF or harvesting the sperms from the tests, it can be very expensive because it involves medical consultation, it involves diagnostic tests, that is money, it involves expensive medications, and also fertility treatment is also not 1+1. It really takes a toll on your pockets or money. These costs can add up over time and may pose a burden to individuals and families, especially because this is not something you are prepared to, and especially if you don't have insurance. Like here in Africa, most of the patients don't have that insurance which can take especially care of fertility issues, so it becomes a big challenge for them on the cost aspect. Number 8 complication is brought on the social and relationship impact. So dealing with the retrograde ejaculation can be Diabetes complications may affect the interaction and also relationships with the partners, family members and friends. So open communication and support from loved ones can help navigate the challenges. Like here in Africa, if you are infertile or you are sterile and you are not giving to your own biological children, it becomes a discussion of the village or the community, and people are not very easy on you, from your mother-in-law to the people surrounding you. They really talk bad about when they don't see that you are not giving them the grandchildren, and also the kids, they don't see kids with you. So it becomes a big challenge, and this really takes a toll on the social and relationship. You see that the enmity develops because you can't like when somebody talks bad about those issues, and normally they use a very bad language to talk about it. So it's not an easy thing, but I want to encourage, if you have someone in your family who has such kind of a challenge, it's always good to have that open communication and support loved ones, so that as you also, they help you navigate the challenges you are facing, because that community, that support is very important at that particular point. So overall, addressing the retrograde ejaculation and its complications require a comprehensive approach that may involve medical treatment, lifestyle modifications, psychological support, and fertility interventions. So it is essential for individuals experiencing symptoms of retrograde ejaculation to seek evaluation and treatment from a healthcare professional, so that to minimize complications and improve the overall health of and the quality of life at that particular point. How can we prevent complications? Is always manage underlying medical conditions as appropriate. I've mentioned of multiple sclerosis, I've mentioned about diabetes, I've mentioned about spinal cord injury, I've mentioned about prostate disorders, so that to help reduce the risk of nerve damage, so, and also dysfunction, which may contribute to the retrograde ejaculation. So if you have that kind of a challenge as a patient or as a client, kindly follow up treatment plans as prescribed by your healthcare provider. If it's your fertility doctor or a specialist, if it is your urologist, kindly follow what they are telling you. And also, very important, report back any challenges you are facing with it, and also go for those regular checkups, because that is very important for you. Also about avoiding the drugs which affect your bladder function. So normally, if you discuss with the healthcare provider, he will or she will give you options where the risks are weighed against the benefits, so that you get the appropriate management or the treatments, and also to explore the appropriate options for your treatment, because we always want you to get the best at the end of the day. I talked about, as a preventive measure, always practice safe sex, because STIs have been seen to also cause problems with your urinary tract system, so that you don't get into problems. If you get into multiple sexual interactions, kindly protection is very important. Also, maintaining health lifestyle is also a very good option for you. Maintain healthy weight, eat a balanced diet, and also exercise, be active in your life as much as possible, so that you avoid a lot of problems at the end of the day. So also I talked about seeking prompt medical attention is a very important aspect. As you see those signs and symptoms like cloud urine and dry orgasm, kindly see your doctor or your healthcare provider, so that you get proper attention at the end of the day. Men don't like to discuss here, especially in Africa, about their sexuality, but men, it is what it is, and that now we should wake up and work with that. Guys, in conclusion, I want to say Retrograde ejaculation is a condition where semen enters the bladder instead of being ejaculated through the penis during orgasm. So it can result from various factors, like I mentioned, like when as a complication of surgery. It can be nerve damage, it can be medication or medical conditions. So common symptoms include dry orgasm, and I've explained it, and cloudy urine after ejaculation. So diagnosis involve urine analysis in post-ejaculation. Treatment options include medication, adjusting medications also as a treatment. Fertility treatment, so that you get to sire a child through fertility treatment, and also surgery can be one of the best options for that one, guys. Prevention strategies involve managing the underlying condition, that's very important, and also avoiding medication that affect bladder function, practicing safe sex, and also maintaining health lifestyles. So I've mentioned about complications like infertility, reduced sexual satisfaction, psychological impact, and also underlying health conditions. So guys, very important, early detection and treatment can help manage retrograde ejaculation, and also more so, guys, improve the quality of your life. Guys, welcome. This is Nazvin here talking about retrograde ejaculation, and I want to welcome you to our next video, guys. Peace, guys.